Complicated CDI was defined as anybody who died within 30 days of diagnosis or anybody who had any abnormal findings on the CT scan. So that included colonic dilatation, any evidence of distension, or ileus, ascites, or any thickened colonic wall. This study was conducted in a single 722-bed tertiary referral center in a mostly urban setting down in the South. However, I do think that the findings are applicable outside of just our institution. I think that what people will find when they view the results of this study is that a lot of their providers have the same habits. The other thing to keep in mind is that most of this data was collected prior to the new guideline updates, and so therefore anybody who looks at prescribing patterns prior to that and any of the patients prior to the guideline change will probably see similar results as well. So some of the interesting findings that we had coming out of this research, primarily that we looked at, what exposures did patients have coming in, what other characteristics, what lab values kind of stood out that we could potentially use later to determine, identifying these patients quicker, sooner, faster to give us the information we need to better treat them. And so what we ended up finding is that patients who were exposed to Bactrim as well as any fluoroquinolone, just any exposure, duration didn't matter, they were at higher risk of having complicated CDI. Patients who were on carbapenem therapy longer, not necessarily getting carbapenems, but just on it longer, or also at higher risk of having complicated CDI. So that was big. Some additional factors, complicated CDI patients had a higher Apache 2 score, so we're talking 13 versus 22, so that was kind of a big indicator right there. Some traditional markers for infection, CRP and lactate, were both elevated in the complicated CDI patients compared to the uncomplicated CDI patients. So that made a difference. Treatment of the current episode of CDI was essentially not significantly different between the two groups. So it didn't matter what they had, they were still getting treated the same way. So that was an interesting finding. However, complicated patients had a longer infection-related length of stay and were more likely to die, which was obviously included in the definition of complicated, but still we're talking, almost a quarter of those patients passed away from the disease. And so I think that was some interesting things that we could take away from this.